Hi everybody and welcome back to my vlog. So, continuing as we are on fillers at the moment and the different wonderful things they can be used for, I decided after doing this week, because it jogged my memory, to talk about hands. And nobody ever talks about hands. But if you think about it, if you use fillers to make yourself look fresher and younger in your face and everywhere else, the giveaways are the neck, and we are going to talk about that at some other point, and hands, backs of hands. Now, I always joke that I've had hands that look 40 years older than me since I was young, but the telltale signs on hands really are the veins that start to become much more prominent, the ligaments. So when you look at somebody younger, they have the backs of their hands are naturally nice and smooth. So if I really tighten my hand, it's nice and smooth. But if I loosen it out, you can start to see all the ligaments and the veins. And that becomes more and more pronounced again as we lose fat in those areas as we get older. So you'd think there was nothing we could do about that, but there are, and we can address it with fillers. And we can almost use any type of filler, but obviously you need something that's reasonably light because there's not much space again in the hands. So you don't want to be seeing big lumps of lumpy, heavy filler. But at the end of the day, the aim is to actually lift out those areas between the ligaments that you can see that are sunken in, and stretching out the skin above it, obviously, which reduces some of the crepiness, and it also makes some of those prominent veins disappear. But they need to be done carefully because prominent veins is the answer. There are lots and lots of them in the hands, so you don't want to be just sticking a needle through there, breaking them and having hands that are absolutely full of bruises. And neither do you want to be putting filler into any of those veins or arteries. So how do we do hands? So I've just done some actually, which I think are going to go up on Instagram. I don't do the Instagram, so I'll have to check with the lovely Phoebe, who runs everything, properly. So we use, most of the time, I use one of the skin booster ranges, so Restylane Vital Skin Booster. You can use Profilo, and you can use a very light filler, something like Burbella, or even something slightly heavier like Restylane Refine. And it really depends on how confident you are and how bad the hands is, how much they're going to need. Because if they're really pronounced and there are big gaps, then you're going to need something slightly heavier, so probably a Restylane Refine. But all of those work equally well. The most important thing is that we use a cannula. So we use a nice long cannula because you want to get up between all of those ligaments and right to the top of the hand, and you want to make as few holes as possible because the fewer holes you make, the less chance of infection getting in. So I generally go in somewhere along here, sometimes there, with my entry points, and then I feed the cannula like this all along the hand, and I just deposit the filler in all of the areas that I can see that are sunken in or around the big, really big veins. And the results are amazing. So it instantly makes the hands look younger. And I think that's a really important thing because there's nothing worse than looking down at your hands and thinking, oh, they're so old. So if you're going to use skin boosters or even a Profilo, you're going to need more than one treatment. So with skin boosters, you're probably going to need one a month for 3 months, then one in 6 months, and then a maintenance once a year. For Profilo, you'll definitely need at least 2, possibly 3 a month apart. But each time it will get better and better. If you're going to use something like Restylane Refine, you might only need 1 treatment, possibly 2. So I think the important thing to know about the hands is, firstly, they can be made to look younger. It's not, you know, a fait accompli and you're stuck with them forever. And secondly, the product that you use is really varied, and it's down to the practitioner and how comfortable they are. It's also down to how much atrophy you've got on the hands, how much work needs to be done. You do need at least 1 ml for each hand, probably more. It does take up quite a lot of filler, so you need to know that. And then the really important thing is that the practitioner uses a cannula. So a cannula starting around the knuckle area, just feeding up between those ligaments. Beautiful result, and you'll see it very quickly. Also, of course, if you use something like Profilo and skin boosters, you'll also get that collagen boost and that skin resurfacing above it. And I guess from that perspective, you could use one of the Alonzes, but they're quite heavy and not reversible, but you do get that beautiful skin resurfacing above it. I haven't used Alonze for hands, but that doesn't mean I won't, and I will think about it. But definitely can be done. Very easy to do. It's not a difficult procedure to do at all, and it isn't very painful either, especially with a cannula. So if you're getting to my age, which as you all probably know is about 53, it is 53, and you fancy rejuvenating your hands, ask your practitioner if they've ever done it, and if not, find one that has. But I know that was a really quick vlog this week, but it's no less important. It's just quite simple, and I hope you enjoyed it. And any questions that you've got, please just ask them afterwards in the comments under the vlog or on the Instagram page, and we will always answer. And if you've got any suggestions for anything else you want me to cover, just mention it and I will do it happily. So off we go. I might go and get my hands done, and I'll see you next time for whatever topic we choose to do then.